Now periodicity is a typical feature in the case of the frontal sinus infection. The more you sleep, the more drainage is there, and when you wake up, you typically have got the headache. Ranula is not cannula, as you know very well, that it arises from sublingual gland, not submandibular gland is what need to be remembered. Should be an answer. Inactivation of 60S ribosome by cleaving rRNA is a typical mechanism of action of which antibiotics? 2 antibiotics you should not forget. Who will give me the correct answer? Guntur says aminoglycoside. Our Manu Krishnan says erythromycin. Shankar says tetracycline. All antibiotics if you say, then what is left over? Who will give me correct confident answer? See doctor, oh sorry, which organisms? I forgot, I said antibiotics, right? So 2 organisms, I am sorry about it. Shigella and enterohemorrhagic E. coli. Don't forget, they will inactivate the 60S ribosome by cleaving tRNA. Instead of saying organism, I said antibiotic. Okay, all right. But this is going to be the favorite question of the examiner. Be very sure. Now, grey white membrane can be seen with everything not Ludwig's angina, which is fundamentally a cellulitis. What is the best time to operate Quincy? 6 weeks. You are going to remember. Screening purpose क्या है? जरा जल्दी बताना है cancer है बोल के, so that the patient can die a little more comfortably, knowing the news a little early, which comes under secondary prevention. If a new drug is invented but it does not affect a cure, what will happen? Old cases will be more, so there is a reason prevalence will typically increase. Twice the incubation period you conduct an epidemiological study. Measles induced by vaccine, unlike infection induced measles. What is the duration? Incubation period? 7 days. Actual disease may 10 days. Hence, for how long you can be able to give the measles vaccine after post exposure? 3 days. So this difference you must know. Vaccine induced measles is 7 days. Disease induced, actual disease is 10 days. So difference is 3 days, until which you can be able to give the vaccine post exposure. Now doctor, what is the most predominant type of poliovirus? It is a type 1 which is most predominant. What is a contact carrier? Contact carrier is also called healthy carrier. Healthy carrier. So, the duration of the contact carrier is usually less than 10 days is what need to be remembered. Infant parasite index is a very sensitive index in malaria. Man is a definitive host. Whereas the mosquito is the intermediate host, but for both the types of filariasis. Okay doc, I am back with microbiology for you. There are 4 organisms you are going to give me an answer. All the 4 are beta hemolytic basically, which is catalase, coagulase positive, catalase negative, bacitracin sensitive, catalase negative, bacitracin resistant, tumbling motility, unpasteurized milk, beta hemolysis. You give me 4 answers that will make you to pass microbiology. Yes, whatever online students are saying. I am talking about strepto, sir. Streptococcus pyogenes, Streptococcus viridans and Listeria. And the first organism is mentioned as Staphylococcus aureus. Are you also in agreement with that? Staph, strep pyogenes, strep epilepticus and listeria, says Dilip. That's right. Staph, strep pyogenes, strep epilepticus, listeria. So this is one question you are going to remember me in the exam hall. Now, class 3 dog bite. What do you want to do? Don't stitch the wound immediately. I think easiest question. You know what to do with class 1, 2, 3. I leave the literature for you. After 2 doses of vaccination, immunity in plague will last for about 6 months. Lepramin test will be positive if the cell-mediated immunity is intact, as it happens in tuberculoid form of leprosy. Most common will be autosomal dominant disorders. Recessive will kill the people even before they enter puberty. So what you see predominantly is autosomal dominant kind of an inherited disorders. Under school training program, who will check the vision of the child? It is the school teacher who is the responsible person, who need to identify that Ramu is not attentive in the class, not because of his poor attention, but because of the poor vision. More than poor vision, what is responsible for the Ramu's inattention? Poor teacher is responsible for the Ramu's inattention. Mala N contains what? D contains what? N contains norgestrel 0.3 mg and ethinyl estradiol 0.03 mg is what need to be remembered. Recent fertility pattern, it is the net reproduction rate, which will give you a better index. What is net reproduction rate? Number of daughters a newborn girl will bear during her lifetime, assuming the age specific fertility and mortality rates. Okay, doctor. We come to the proper SPM questions, which will not be sleep promoting but awakening questions.